have my presentation. And I just wanted to give you a little bit background of myself. I'm an associate professor in the School of Health, School of Medicine and Health, University of Sydney. I did my bachelor degree honors and MA from the University of Dhaka. Then I did my master's from Australian National University and a PhD from University of Queensland, Australia. I'm a recipient of a few awards, and also I have been chief investigator of quite a few international and national grants and published widely in the journal, peer-reviewed journal, also have many book chapters. I'm the founding secretary of this association in 1996 when the association was formed, and I came back again, and now I'm the secretary of this association. And my research is basically on women's health, breast cancer, cervical cancer, quality of life, and also inequality and resource limited countries. This is about me. So I'd like to have my presentation. Are you going to share my presentation slides? Jaya? Okay. My topic is diversity and inclusion, COVID-19 impact on socially disadvantaged groups in Australia. Next slide, please. So I'll be focusing on talking about the socially disadvantaged culturally linguistically diverse groups as well. When we talk about socially disadvantaged groups, basically we talk about people who are disadvantaged because of their race, because of their ethnicity, class, gender, and their life chances and their opportunities are often affected by that. Disadvantage can lead to exclusion from society. Also have they will have limited access to economic activities as well as goods and services and resources and all activities. So these people are sometimes we see them in the lower socioeconomic status standing. And we have culturally and linguistically diverse background population, and they are the one with a culturally and linguistically diverse group. That's what we are meaning here, called and socially disadvantaged group. Next slides, please. As you know, we are facing this global pandemic. This is worldwide global pandemic. It started in 2020, and the figures are keep changing. If we look at this world map, what it's showing is darker color showing where the highest prevalence and incidence of and also the highest death rate. World today is 251,788,329 cases and 5,077,907 deaths. If you look at Australia, Australia's death rate is quite low and the color is very light, 181,578. So if you look at this, it shows that disproportionately COVID-19 has been impacted in many parts of the world. America has the highest incidence, highest cases, like 94 million, and Europe is 80 million. If you look at Southeast Asia, 44 million, and Eastern Mediterranean is 16 million. Next slide, please. So here we have got Australian figures. It shows in Australia there are different, if we look at this on the left-hand side, that shows the current figure of Australia and its death and the current cases. 140 is the people who are in ICU. 836 is in the hospitalization. And then if you look at on the right-hand side, this is the area where you can see that the different states has got different number. Queensland, and then we have the New South Wales and Victoria has the highest. And the median age of COVID cases is 30 years, and the median age of death is 83 years. So there are gender differences in terms of cases and infection, as well as in terms of the death, the mortality. Next, I think I would like to also show here in the middle that here, the number of cases that has been increasing this year, like in June, July to until now, quite a lot. Here it shows the number of people infected by age group and gender. You can see that younger group are more affected. In this one, it is more likely that older people, the death rate is in here. So it's more deaths are in the older age group. Next slide, please. So it's again coming back to this, it shows that evidence shows that more younger people are affected by COVID-19. And you can see the gender difference in here. Female are more likely to be impacted at a young age. And gradually, if you look at the deaths are more among the older people, as I mentioned earlier. And there are gender differences, more deaths among male. So it is really good to see that the inequalities in terms of cases and infection, as well as in terms of deaths, are there by age group. Next slide, please. This research is based on a secondary sources of data. I'll go back to that point. When you talk about called community, a multicultural Australia, Australia is a multicultural society. We have about last census shows that 28% of people are from culturally diverse backgrounds. Shows about a third, like 30%. 300 separate ethnic groups are in Australia, and they are all 300 separate languages they speak. In 2016, the last census shows that one-fifth of Australian people language other than English at home. So this is really important to know that cultural differences are quite increasing, and it's important to understand Australia's health and inequality. And 3.3% are Australian Aboriginal population in the Australian population. And next slide, please. So the presentation is based on a secondary sources of data. Primary data collection is still, it couldn't be done yet. So we are basing on all the published materials and the data. It shows that I'm going to use some examples that inequalities in terms of in the socially disadvantaged group. And looking at the global pandemic, you can see that disproportionately it affects the health and social well-being of vulnerable communities. And most recent study shows that migrant workers are more likely to be the most vulnerable groups. In the pandemic, we see that evidence from UK showing that those who are living in the poverty, overcrowding housing, low education, and inadequate access to health services, they are the one who experience high level of COVID infection, and they have more poor outcome, that means high level of death. Unique condition actually for the socially disadvantaged group, and because they have language barriers and there are prejudice and discrimination as well. And we can see that racism are there, and this happens to certain ethnic groups. It is more among certain ethnic groups. And there are limited access to available services because of these, their barriers. And those with the low access, they are the ones who are more likely to experience psychological distress and social isolation. And this situation is more worse when we see that lockdown is there. Excess mortality happens in certain ethnic groups, and the data shows that Black, Asian, and minority ethnic groups are the ones who are more likely to experience this high level of excess deaths. And it's Asian background. These are the communities are more likely to experience this risk of high level of deaths. Next slide, please. Some example from Australia, we can see that coal communities in Australia are more affected, those who are living in the hotspot areas, and those are the areas where the more concentration is from a socially disadvantaged group. Class, ethnicity, religion, culture, and language barrier, we already mentioned about that. That is exacerbated these differences. And some industry people are experiencing more, losing their job, and more people in these industries will be, they're more impacted. For example, aged care and hospitality areas. And we see most of these workers are from socially disadvantaged group or the culturally linguistically diverse background population. Temporary migrant, they are the more vulnerable, and they also experience some of the job losses, because job losses happens in those industries where they employ more migrant community. Report also shows that early quarter, like 23% of temporary migrant experienced verbal abuses. And I also mentioned that some abuses happens to specific communities, for example, Chinese group, East Asian background communities. And the presence of racism and discriminations are there, and this that is really important to understand the inequalities and exclusion, social exclusion. Next slide, please. So some more example from Australia is about that other issues, for example, called community crisis, more complicated when you see that migrant communities have restriction on mobility during the lockdown period. They have less access to the services because of the language barrier. We see some of these services they used with the use of interpreter services, and because of the lockdown situation, and these services are limited and they had limited access. Therefore, that has more impact on their physical as well as mental health. During the vaccination rollout period, we see that COL communities remain a critical frontier for a COL community's lack of literacy, and that has had some impact on the vaccination enrollment and vaccination completion. COL women are more also affected by these global challenges, and we see that women are more likely to experience some of these service provision because they have less access to those. And some of these services, for example, sexuality and reproductive health, mental health, and occupational health, here are the women are more likely to lose the employment, and because of the restriction they have, it has impact on their reproductive health. And many women also experience some domestic violence as well. Thank you so much. Next slide, please. So from all these things, we can clearly see that social exclusion and the social diversity and exclusion are very important in this COVID world. And we already have these inequalities, and COVID has made more challenges for these communities in terms of accessing services and in terms of using the services. And therefore, there is a sense of belonging, social inclusion, and citizenship. These are very, very, very much impacted. So in this session, we are talking about solidarity. We are talking about collaboration. Therefore, it is important to have a multidisciplinary approach, and responsible, transparent, and migrant inclusive public information strategies are very, very important. So we would like to say that strategies should include regular, accurate, and linguistically and culturally appropriate public communication and information sharing alongside community mobilization. Confronting racism and prejudice with a zero tolerance approach should be the core of government and social action. And this is also, we are looking here that this is not only in Australia, it is a global phenomenon. This sort of initiative, these sort of situations are also existing in other countries. So we need to see that we are doing collaborative research, collaborative action, and international programs are there to minimize this exclusion, and inclusion is there, and citizenship are respected. Thank you so much. And that's from my presentation. Thank you for listening. And again, if you have any question, anything, please keep it with you, and we'll come back to that after our next presentation. Thank you, everyone. If you have any questions, just keep it with you and let us know.